Biomimetic dentistry utilizes research-proven techniques to minimize polymerization stress, thereby increasing bond strength, resulting in long-lasting restorations. So, there are two protocols, bond maximizing protocols and stress reducing protocols. Bond maximizing protocols are establish a caries-free peripheral seals on air abraded surfaces, bevel enamel, deactivate matrix metalloproteinases, employ gold standard adhesives, immediate dentine sealing, resin coating, demargin elevation. Stress reducing protocols are indirect or semi-direct restorations for the occlusal and interproximal enamel replacement, decoupling with time, thin horizontal layers of composite less than 1 mm, fiber insert on pulpal floor and axial wall, low start pulse activation polymerization techniques, composite with shrinkage rates lower than 3% and elastic modulus between 12 GPa and 20 GPa. For pulse chambers, use dual cure composite for the first 5 minutes. Removal of dentine cracks completely within 2 mm of dentino-enamel junction. Limit only cuspids to thinner than 2 mm. Verticalize occlusal forces. Biomimetic paradigms. Biomimetic restorative dentistry is founded on these four basic paradigms. First one is maximum bond strength. Reducing polymerization stress to the developing hybrid layer results in a 300% to 400% increase in bond strength. Dentin bond strengths in the range of 30 MBA to 60 MBA are in the same range as the tensile strength of enamel, the dentino-enamel junction and dentin. The strong bond allow the biomimetically restored tooth to function and handle functional stresses like an intact natural tooth. Long-term marginal seal. A strong and secure bond allows for a long-term marginal seal to be established and maintained during functional stresses. Increased pulp vitality. By maintaining a highly bonded seal, the restoration will provide long-term function without recurrent decay, dental fractures, or pulp death. A vital tooth is also 3 times more resistant to fracture. Decrease in residual stress. Residual stress, while hard to visualize, lead to cuspal deformation, debonding, gaps, cracks, pain and sensitivity, and recurrent decay. Reducing residual stress while maintaining the maximum possible bond strength is the ultimate goal of any biomimetic restorative technique. Stress reducing protocols. 10 key stress reducing protocols which promote stress reduction to the developing hybrid layer as it is formed and throughout the life of the restoration under function. Use indirect to semi-direct restorations for occlusal and interproximal enamel replacements. And indirect technique is the most stress reduced technique. It reduces the volume of shrinking restorative material. This also reduces residual stress. Decoupled with time, this protocol states that polymerization shrinkage stress to the developing dentin bond of hybrid layer should be minimized for a certain period of time, that is about 5 to 30 minutes, by keeping initial increments to a minimum thickness. This minimal thickness prevents the connection or coupling of deep dentin to superficial dentin before the hybrid layer is matured and close to full strength. This procedure neutralizes the hierarchy of bondability, which states that the shrinkage of composite move towards the walls of the preparation that are most mineralized and dry and flows away from the walls of the preparation that are most moist and organic. So polymerization stresses in 1 minute 70% of stress is eliminated. So if we can wait for 3 minutes, 80% of the stress is eliminated. And if we can wait for 5 minutes, 90% of stress is eliminated. 30 minutes, 95% of the stress is eliminated. And 120 minutes, 100% of the stress is eliminated. Restore the dentin with thin horizontal layers of composite that are 1 mm or less. This ensures that decoupling with time is properly achieved and that the flow of the composite is not moving away from deep dentin during early stages of horizontal layer development. This is the solution problem of the preparation's complex geometry and the resulting configuration stresses, which are known as C-factor stresses. Small volume increments are always associated with small ratios of bonded to unbonded surface areas. The high C-factor stresses can be reduced to micro C-factor stresses. This is basic protocol of stress reduced direct composite technique. So this figure shows difference between a biomimetic filling, traditional filling, and a bulk filling. Bulk filling, high shrinkage stresses occur. Traditional filling, moderate shrinkage stresses occur. And in biomimetic filling, minimal shrinkage stresses occur. As you can see, 1 mm small increments are placed. So for large restoration, place fiber insert on pulpal floor and or axial wall to minimize stress on the developing bond strength of hybrid layer. The fiber nets allow the composite on either side the net to move in different directions via micro shifting of woven fibers. The polymer network is still highly connected, but the polymerization shrinkage does not stress the hybrid layer. Advantages of fiber reinforced composite restoration include rebound, reinforces structurally compromised teeth. Studies shows that rebound mitigates the harmful effect of C-factor. Shrinkage of the composite against the tooth is dramatically reduced, preventing gap formation, leakage, and sensitivity. So, of this fiber. So step 1 is make preparation. Round the internal line angles and recontour the cavity walls to eliminate gross irregularities in the internal surfaces. Step 2. Measure and cut the amount of ribbon needed. Ideally, one ribbon piece will cover the pulpal floor and partially over the buccal, lingual, mesial and the distal walls of the cavity. For deep preparations in which one piece of ribbon cannot cover most of the internal cavity surfaces, add 1 or 2 additional pieces of ribbon to encircle the cavity walls. Step 3. Cut the ribbon to prevent small pieces of ribbon from springing away from when cutting. Hold the ribbon with metal pliers. So, step 4. Prepare cavity for bonding and apply bonding resin. Use your preferred bonding adhesives and preferred techniques to bond to the tooth and cure. Step 5. Wet the ribbon with resin. Thoroughly wet the ribbon with ribbon wetting resin or an unfilled bonding adhesive. Lightly massage the resin into the fibers with an instrument. Do not cure yet. Step 6. Remove the excess resin from wetted ribbon. Move the wetted ribbon to a dry area on a mixing pad and gently dab a gloved finger against the ribbon to remove excess resin. The ribbon should remain thoroughly wetted but not dripping wet. Step 7. Apply a thin 0.5 mm thick layer of a tacky viscous flowable composite on the pulpal floor and on the cavity walls where the ribbon will be placed. Do not cure yet. Step 8. Place the wetted ribbon onto the uncured tacky flowable composite that was placed into the preparation. Press the ribbon through the composite so that it is closely bonded against the tooth. Step 9. Cure. Like cure after placing all of the ribbon pieces. Step 10. Finish the restoration. Incrementally place composite using your preferred composite technique and complete the restoration. So, this is another method. Make a flat filled composite pad, wet ribbon with adhesive and press into the uncured filled composite and then remove excess composite and gently slide in instrument when under composite. Place ribbon with the uncured composite side against the tooth. Press the ribbon through the composite that is on bottom of the ribbon so that the ribbon is closely bonded against the tooth surfaces. Use slow start or pulse activation or polymerization technique. So slow start protocol is that 20 seconds of 230 milliwatt per centimeter square and dark for 10 seconds and again 20 seconds at a minimum 460 milliwatt per centimeter square can be up to 600,000. Sixth one, use Rendon replacing composites with shrinkage rates of less than 3% with the modulus of elasticity between 12 GPa and 20 GPa. 7. When restoring pulp chamber in non-vital teeth, use dual cure composite with chemical cure mode and active for first 5 minutes. The volume of composite is not critical for chemically cured composite because the chemical initiation of polymerization is very slow. This slow polymerization allows sufficient time of the dentin bonding system to mature into a strong hybrid layer. Remove dentin cracks completely within 2 mm of the dentino-enamel junction. This area is referred to as peripheral seal zone. Remove all dentin cracks inside of the peripheral seal zone to a depth of 5 mm from the occlusal surface and to a depth of 3 mm interproximally from the axial wall. If crack into the dentin are left under the restoration, micro movement under function will allow the cracks to get longer. Larger cracks propagate with smaller forces than shorter cracks. Therefore, it is recommended to remove as much as of the cracked dentin as possible without exposing the pulp. Limit only cuspids to thinner than 2 mm after removal of decay and cracked dentin. This will change the forces on the hybrid layer from predominantly tensile to predominantly compressive, which helps reduce bond fatigue. Vertically occlusal forces to reduce tensile stresses to the restoration and the cervical region of the tooth. This can be done by restoring anterior guidance with bonded composite to the lingual surface of maxillary cuspids and or the facial surface of mandibular cuspids. Next is bond maximizing protocols.